Assalamu alaikum, my lovely nurses. I hope you are all fine. So today our topic is atrial fibrillation. Atrial fibrillation. We are also telling this one AFib. AFib. So atrial fibrillation, how we can define atrial fibrillation is uncoordinated electrical activity in the atria that cause rapid and disorganized fibbing. This one like this fib, and disorganized you can see in the ECG strip. Some are have more gap, little gap, again too much gap, again small gap, then again too much big gap. So all are have disorganized, irregular gaps, fibbing of the muscles in the atrium. So this is the definition of atrial fibrillation. What is atrial fibrillation? Uncoordinated electrical activity in the atria that cause rapid and disorganized fibbing of the muscles in the atrium. If we will talk about this strip, so the rate usually over 100 beats per minute. Rhythm irregular. P wave none. They are irregular fibrillary waves. See, fibrillary. All waves are fibbing. Fibrillary waves. There is no P wave. PR interval visible. QRS complex normal. See, QRS. All QRS complex are normal. The gap in the QRS is all same, is normal, less than 0.6 to 0.12, 0.06 to 0.12 seconds. This is the normal gap of the QRS complex. So what we can say, if we will talk about this all, what we can say, the atria is quivering. Now what's the causes of AFib? Causes of AFib is open heart surgery, heart failure, COPD, chronic obstructive pulmonary disease, hypertension, and ischemic heart disease. These are the causes of atrial fibrillation. Now what's the sign and symptoms once patient will be present to the emergency department or inpatient with the AFib? So what is the sign symptoms? Most commonly asymptomatic. Commonly asymptomatic. asymptomatic. Fatigue, malaise, dizziness, shortness of breath, tachycardia, as I told you, mostly more than 100 beats per minute, anxiety, and palpitation. These are the sign symptoms of the AFib, and all due to low oxygen. All due to low oxygen, because oxygen is not properly going to the heart. That's why this is all problems coming due to the low oxygen. The treatment of the AFib, first, yes, of course, we will give oxygen therapy, too much important. Drug therapy, what drug therapy we will use, which medication we will use? Beta blockers, calcium channel blockers, digoxin, anticoagulant therapy, that is too much important in AFib. Anticoagulant therapy, that is very, very important to prevent clots, because the atria cure, because this is related to atria, so the atria cure causes pulling of blood in the heart, which increases the risk for clots. So increased risk of, if there is a clots, what will happen? Because the atria is causes pulling of blood in the heart, so what will happen? The increase risk of clots. If there is a risk of clots, what will happen? Increase the risk of MI, myocardial infarction, CVAs or DVT, CVAs and DVT, deep vein thrombosis. If unstable patient, in the unstable patients, what we will do with oxygen, yes, this is most important, but with oxygen what we will do? Cardioversion. But what's the meaning of cardioversion? The synchronized administration of shock delivery in sync with QRS wave. That is cardioversion. Keep in your mind always, cardioversion is not defib. Cardioversion is not defibrillation. Defibrillation we are only giving with deadly rhythm. If patient don't have pulse, only that time we are giving defibrillation. So this is the lecture of atrial fibrillation. I hope you like. If you like, please share, subscribe my channel, and don't forget to push the bell button so you can receive my coming videos notification. Thank you very much. Allah Hafiz.